In the past, we've done studies combining regorafenib plus nivolumab in patients with MSS colon cancer. As you know, the immunotherapy has a role in colon cancer, but those are patients who are MMR deficient or MSI high patient. So there's a lot of effort to see if it could change the microenvironment so that immunotherapy will work in MSS colon cancer. So we've presented it. We published data combining regorafenib and nivolumab in MSS colon cancer, which had about 51 patients, which has not been published. Data was not as promising as the original data that was first presented in Japan, where the response rate was only maybe 10%. So the question is, which of those 10% of the patients do actually benefit from the therapy? So, we were lucky enough to get some tissues. Once again, we didn't have all 51 tissues. We had about maybe 20 samples that were available from the study. And what we found out from the study was that, there was what we call a Xerna TME panel, which is a learning-based RNA sequencing biomarker assay that were sort of classified into 4 different categories. One is angiogenesis, the second was immune active, third one's immune desert, and fourth is immunosuppressive. So once again, these are just RNA sequencing data with biomarker, which can potentially predict which patients do respond to the combination of immunotherapy and TKI. And what we did found was that the Xerna TME biomarker, positive patients in the immune active cohort seems to have a longer PFS and a longer overall survival. We also had opportunity to do immunohistochemistry, look at immunobiomarker as well. And there was really no correlation with RAS mutation or PD-L1 expression. However, low Treg was found to be associated with prolonged PFS, but not overall survival. So those were some of the findings that we found. Obviously, these are very limited by the small sample size, but I do think that this TME panel with the Xerna may in the future need to be done in other prospective study to validate this finding. So if you're able to find this potential patient that's immune active gene signature based on RNA sequencing, maybe those are the patients that benefit from the combination. But still, larger prospective study needs to be done to validate the finding.